Are we recording? Yes, I think we are. So, welcome to the conference call for September. Hope you've all been enjoying the summer. I kind of feel it's getting a bit autumny now. Don't know what it's like where you are. So, as we're going to hear shortly, there's quite a lot to do, I think, in the coming months to help the UK government move um, back in the right direction when it comes to its international development efforts. So, thank you as always for the part you're playing in this. And I really do see results volunteers as being in the vanguard of holding the government to account. I hope the remarks I'll make in a minute can kind of demonstrate that. I will see. So I don't think we've got any brand new people on the call. Welcome, Oscar. Welcome, Abbas. Just seen you arrive. Um, so, as always, I will still start with the housekeeping messages. So please keep yourself muted during the call if you can. If you've got any questions or comments, please use the chat box. And captions are turned on for you to use or not use as you want using the Zoom toolbar. And we are recording the call as always. And if you don't want to be seen, then please feel free to keep your screen off. Okay, so does anyone want to just say hello? Introduce yourselves. We've had a little bit of a chat, haven't we? So I will start off then with the usual round of updates on the things that are going on around about our advocacy on global poverty issues. So I think we already mentioned last month that the government released figures confirming our fear, so results' fear, that they aren't going to be prioritising global education as much as they should be. And this is a big worry, particularly with the Global Partnership for Education, GPE, coming up shortly. It's replenishment. It goes in 5-year chunks, unlike the Global Fund, for example, it's a bit longer. And we believe they're going to be kicking off the replenishment for this at the United Nations later this month. I think the 23rd or the 24th of September. But the conference won't be itself won't be until sometime in 2026, possibly early summer. So, and we've got a little bit of a while on this one. And GPE, Global Partnership for Education, will be asking for $5 billion from international donors, which is the same amount as they asked in 2021. What they actually got was 4 billion. Now, how does this sit with what we know at the moment? We expect the FCDO's budget allocations for the years 2026 to 2029 to be made in November. Now, the date for that has been kicked down the road several times already, but it means that deprioritisation of education, which we heard about, whilst it's disappointing, it's something we can and should still be arguing against. So a huge thank you to everybody who's been continuing to put pressure on the Minister on this topic. We don't yet have an agreed monetary figure that we think GPE needs from the UK government. Our partners in the world of education are kind of discussing that at the moment. So we will be likely to come back to you with a more specific education ask than we've had in recent months in a while. For reference, back in 2021, the last replenishment conference, the UK pledged £430 million over 5 years. So a little bit smaller than some of the health ones. But obviously we're in a much more constrained budgetary environment now, so we may need to temper our ambitions somewhat, given the scale of the cuts to the official development assistance budget that we've been facing since then. But that is to say that's all to come. So just really giving you all a heads up on that. Next, and in a similarly realistic vein, shall we say, I want to thank you all for all the polio campaigning you've been doing in August. For years, obviously, we've been talking about one last push from language like that to eradicate the disease from the planet. But in recent years, as you know, or many of you know, we've seen a small but worrying increase in cases, which could turn into a resurgence of the disease. Obviously, it hasn't come to that yet, but the risk is there, and especially with the stagnation of the funding that's needed to keep up with the surveillance and the vaccination efforts. So again, a big thank you to those of you who were able to write to the Foreign Secretary and Baroness Chapman last month, thanking them for their, in the circumstances, impressive pledge to Gavi, the Vaccine Alliance, but asking them not to forget polio. Now, we had some news just last week, which I'm going to let you in on. So privately, we've just been told that the UK has allocated money to the GPEI, so Global Polio Eradication Initiative, but they've not made it public. And so please keep what I'm about to tell you under your hats, and certainly don't, if you don't mind, write any follow-up letters about it. You may recall last month we asked them for £50 million each for each of the years 2025 and 2026, and they have in fact in their budgeting allocated 20 million in total, which is 10 million for each of those 2 years, i.e. a fifth of what we've been asking for. Now, that sounds pretty poor, but it is in line with the 90% cuts to polio funding since 2021. Now, I think it's really important that we've been doing the action, and however disappointing this sounds, we're actually not seeing this as a failure. And in fact, perhaps somewhat surprisingly, given the low level of funding that this is, GPEI itself sees this as a win because the UK could very easily have provided nothing at all in the current climate. And this funding will help us carry on running polio programs, albeit not at anything like the level we need to see. So I just wanted to share that with you. I'm sorry we can't share that data publicly in any way. I'm told it'll be some time before the FCDO wants to go public with that kind of information, probably presumably until November. But we did take the view that we should share it with you. And I know you'll respect that confidence. We are seeing public messaging from others, such as Global Citizen, who are not mentioning this allocation, but are continuing to gain public support in the run up to World Polio Day on the 24th of October. And we'll just put a couple of links in the chat so you can see what's being said kind of in public. So we're going to put in one article in the Telegraph, which gives a quite a good sort of overview of the state of play with polio eradication at the moment. And kind of sets out the situation as we kind of set out in our action materials last month. And also, Global Citizen are running an action for people to make videos, sort of video messages in support of polio eradication for World Polio Day. And they have some other actions on their website as well. So we do want to carry on. It's good that we can carry on. There's the opportunity to carry on campaigning about this in the future, and some of our allies are doing so. So thank you for your part in this. The next thing I want to move on to is the Global Fund to fight HIV, TB, and malaria. And in a few minutes, as you see that she's arrived, I will be introducing a very special guest speaker who will help us understand its work. Obviously, as many of you on the call already know, these three diseases kill millions of people around the world every year, but they are treatable, and many scientific advances are being made to help us come closer to achieving the global goal to end these diseases as significant health threats around the world by 2030. Now, obviously, those efforts don't just involve having the right medicines, of course, but also diagnosis, effective treatment regimes, community outreach, patient care, all those kinds of things, and also vaccines in the case of malaria and TB. The Global Fund is the largest external source of funding for TB, and as well as investing significantly in countries' efforts to tackle HIV and malaria. We'll post a link in the chat box to a page on the Global Fund's website, which just summarises how it works for those of you who haven't been thinking about the Global Fund for a little while, how it works in partnership, its history, its achievements, and there's a bit of a reminder there with some key statistics. And obviously for us at Results, the achievements are what it's all about, why we advocate for the Global Fund, why it matters. And I'll just quote a couple of the statistics from that page. Since 2002, it has saved 65 million lives around the world and cut the combined death rate from these diseases by 61%. And some of these facts and figures are in their investment case for the 8th replenishment, which is just coming up. And again, we'll put that link to that investment case in there as well for those of you who want to see it. So they're hoping to raise $18 billion for the period 2026 to 2028. So that's a 3-year period, these replenishments for the Global Fund. So if you follow that link, you'll see that the investment, that 18 billion, aims to achieve a number of, I think, pretty amazing things, including saving an additional 23 million lives, averting 400 million infections or cases, strengthening health systems, enhancing pandemic preparedness, and reducing global inequality in life expectancy by 7% between 2023 and 2029. That last statistic floored me a little bit when I read that earlier today. Still on the Global Fund, just today, latest bit of news for you from the staff. We launched a new policy report in Parliament at an event hosted by the Global Fund itself. Now, the policy report is called "The Next Front Line: Health Systems as the Foundation of European Defence," and the report describes the need for strong health systems during conflicts, the role of the Global Fund in building health resilience in Ukraine, and why these are good reasons for the UK to retain its existing or its current £1 billion commitment at the next replenishment. So, the last replenishment 3 years ago, it pledged $1 billion, and we want it to do the same again. So obviously it's about Ukraine. This is very topical, and we hope that it will provide a compelling reason for the UK to continue to support the Global Fund, in addition to all of those compelling reasons that I've just mentioned from its investment case. The report is literally hot off the press, and we will put a link to that in the chat as well. So something a little bit different from us, a little bit more topical. The report was written by Sahira Ramzan, our policy manager and TB policy expert, who many of you know. The replenishment itself will be co-hosted by the UK and South Africa, and may possibly happen around the G20 meeting in South Africa in November, but the date hasn't been confirmed yet. Now, our head of policy advocacy, Alex Runswick, is representing results in coalitions of NGOs supporting the Global Fund, working both across the UK and South Africa, so that together we can speak with one voice. And we're really keen to advocate for the Global Fund collectively, as we have in many previous replenishments. And just lastly, we'll post the link to our campaign action this month, which gives you the action that we're asking people to take if they're able to. So that's all from me for now. I'm going to hand over to Will, who will do the bit about sharing your activities around the country. So Will, over to you.
Yeah, thanks, David, and good evening, everyone. Nice to see you again. So yeah, first, a big thanks to everyone who's shared your letters and responses on education, including Kathy, Karen, Pete, Richard, Ricky, Tony, and Jill. And then also to those of you who followed up on the successful Gavi replenishment with a request for polio funding, including Pete, Jill, Kathy, Richard, Karen, and Lucy. Some of you had shared quite detailed responses from the SCDO on its education priorities, which has been really, really helpful to kind of understand where they are likely to be thinking of protecting or ending particular kinds of education funding. As you know, this is kind of what's up in the air at the moment. Next, a massive shout out to Jill again for meeting her MP in August, raising the issue of debt relief with him. I think it's Luke Taylor. Jill has also managed to get an article in the topic published in The Tablet, which is a widely read Catholic newspaper with a circulation of around 70,000. So that's a great piece of advocacy with a really excellent reach. So thank you very, very much, Jill. So yeah, real congrats on that. And then finally, kind of from me, the Results Board of Trustees is holding its quarterly meeting this week. And 3 members from this grassroots network, Karen, Richard, and Kush, will be attending, as well as playing a part in the overall work of the board in guiding the organisation to achieve its goals and making sure its operations and finances are sound. They will also be leading a short discussion on how our grassroots advocacy is doing. We're still a small network with 6 active groups around the UK at the moment, but the numbers of volunteer advocates has remained stable, with around 50 people being active at any one time. And the number of actions I've taken so far this year have been pretty high. We've had almost 150 actions reported to us so far, and that's higher than average going back over recent years. And we currently cover 32 Westminster constituencies. So, you know, for the size of our network, it's really effective advocacy. Karen, Richard and Kush will also be reporting on progress in improving the way we respond to new potential volunteers, which is kind of salient at the moment, because this is something that Naveed and I are working on right now, alongside an external consultant, to kind of look at ways in which we can kind of onboard our new volunteers and maybe look to expand our network. And hopefully that will begin to bear fruit towards the end of this year and the start of next year, as we kind of implement that onboarding process that we're currently working through. So yeah, that's kind of some updates from results, our actions and kind of stuff going on internally. So now I will return to Naveed to introduce our guest. It's very exciting.
Thanks, Will. I don't know if anyone had any comments on what we've just heard about the activities that have been reported and the network. Okay.
Do we have a shareable link to Jill's article, or is it behind a paywall?
Jill, is it it's not a hyperlink, is it? I think, is that right?
No, I think it was a letter. It was quite a long letter in the letters page, but I used a hook that was there. They were talking about African meetings for progress, so it was just a good segue in. I don't know that I can. I've just got it.
It'd be really fantastic.
There's a paywall on it, you know. So I think, I don't know.
Well done for doing it, and I've read it, and it's really well argued letter that fitted very well with the campaign ask that we had on debt a few months ago. So yeah, thank you so much for doing that.
I could Dropbox it, perhaps.
If we, Jill, would you be prepared to put a?
Yeah, I mean, I'll do anything with it, but I'm just thinking. I'm just going to see if I can find it, and I'll do see what I can do.
Okay. I don't know if you can post things like that in the chat if you've got a file.
Don't worry, we need to go on.
We'll sort it.
We need to crack
anyway,
on.
Thank you again, and yeah, really well argued piece. So okay, so let's move on. Having told you that the Global Fund replenishment is going to be hosted by the UK and South Africa, I think it's appropriate for us to hear from someone in South Africa about just why the Global Fund matters to them, how they work with the Global Fund to address the country's health challenges. I should mention that South Africa is a middle-income country with some significant challenges providing equitable health coverage, which I think we're going to hear about, not least in relation to HIV, TB, and malaria. So I see our guest speaker has arrived, and it is my pleasure to welcome her to the call this evening. She is Mulalo Murudi, and she is the HIV, AIDS, TB, and Occupational Health and Safety Lead at COSATU, which is the Congress of South African Trade Unions. And she is also the co-chair of the Global Fund's Country Coordination Mechanism, or CCM, which I think we're going to be hearing a bit about what that actually is. So she's a great person to help us understand how the Global Fund works in South Africa and what it's able to achieve. So Mulalo, I hope you can hear me. A big welcome to you.
Yes, now I can hear you perfectly clear. Thank you so much. Good evening, everyone.
Good evening. But massive thank you for being with us today. I know it's quite late for you in South Africa. Very lovely to meet you. So we're very grateful for your time spending with us and also for all the work that you do to support the work of the Global Fund in South Africa. And we're really looking forward to hearing about that and to hearing your perspective on the topic. So I think we've explained to you that each month we invite an expert speaker on the topic that we're asking people to advocate about. And I'd like to introduce you to some of the people on this call this evening. You've been hearing a little bit about them, I think, in the last few minutes. So we are joined by results volunteer campaigners from right around the UK, many of whom have been extremely active campaigning for global health and other international development issues for many years. And we also have some people on the call who are newer to this, but are nevertheless very enthusiastic about supporting international development efforts. We have shared some questions with you in advance, but before we get into that, I wonder if you'd be able to just say a little bit about yourself. If you could just introduce yourself briefly. We always like to hear about our speaker. What got you into working with the Global Fund, and in particular, your work at COSATU and the country coordination mechanism. So over to you.
Sure. Thank you so much, Naveed. Good evening once again, everyone. And thank you so much for the warm introduction and for this opportunity to engage with such passionate campaigners and advocates. Really appreciate the opportunity. So as mentioned, my name is Mulalo Murudi. I come from organized labor sector. So I work for a trade union federation, which is called Congress of South African Trade Unions, which is the biggest federation in Southern Africa. But I also serve as the co-chairperson of the Global Fund Country Coordinating Mechanism, known as the CCM in South Africa. So I come from the civil society constituency. All right, that's the constituency that elected me to the position, but also to go to the CCM to drive, the agenda of civil society and communities. So my journey really into this role was not really planned, but it has been one that has been really personal because I've seen how TB and HIV affects the working class people who are really the backbone of our economy, and how health inequalities can entrench poverty and disempower, communities. So for me, this is not just a governance role. It's a commitment to justice, a commitment to access and to equality. And I'm deeply motivated by the opportunity to hold systems accountable and to ensure that the most affected and most marginalized are not only recipients of the service, but also drivers of change. So part of the work that I do at COSATU, I lead the TB, HIV, and OHS desk. So I'm responsible for the coordination of just over 1.5 million workers. So that's just a little bit about me and what I do. Thank you, Naveed.
Thank you, Mulalo. Wow, 1.5 million workers.
Yeah.
Not a small task.
Yeah.
And yeah, lovely to hear your personal story about why, that role on behalf of ordinary people, on behalf of equity and communities is so important to you. So we're going to hand over to people on the call to ask opener questions, as we usually do, which we hope will give a bit of a more detail about the Global Fund. And so the first of those questions, I think, is coming from Paul.
Yes, yes. Well, hello.
Hi.
Hello, Mulalo. Can you tell us, how does the Global Fund to fight HIV, TB and malaria, how does it work in South Africa to ensure that it meets the needs of affected communities?
Okay. No, thank you so much for that question. So, in South Africa, the Global Fund is truly a community grant, right? It is designed not just to fund services, but to empower communities to lead, to implement and monitor their own health responses. So the grant is currently implemented through 3 key stakeholder which are called principal recipients. So the three come from civil society organization, or they implement civil society-based interventions. And the fourth one is a government principal recipient, which we call PRs. The department then works directly with grassroots, community-based organizations and facilities. So this really ensures that services are not only delivered to communities, but they are led by communities in ways that are culturally responsive, context-specific, and sustainable, right? So since 2017, the Global Fund support has capacitated over 1,200 local organizations in South Africa, many of which really started as small community-based organizations and have grown into trusted service providers and community advocates. So these organizations are now deeply embedded in the delivery of HIV prevention, harm reduction, human rights, TB care, and community education. So in addition to that, the Global Fund has introduced what we call community-led monitoring grant in South Africa, which is a powerful tool because it empowers communities to monitor the quality and availability of service at clinics and during outreach, ensuring that community voices shape service improvement and accountability in real life. So from safe spaces and networks of people living with HIV, the Global Fund makes space for those most affected by the three diseases to take ownership of their responses. And this the commitment to community leadership is also embedded in our CCM structure. So the CCM structure is like a board in South Africa that's responsible for the oversight of the investment that we receive from the Global Fund. So it's chaired by two chairpersons. One is the CEO of the South African National AIDS Council, and then also co-chaired by myself as well, coming from a civil society constituency, right? So the CCM is a 21-member board that consists of different constituencies, but the majority of the constituencies being represented is civil society, occupying around 8 main seats. Or we also have your government constituency, your private sector, your provincial AIDS councils, and also your development partners, which is UNAIDS and WHO, also serving in the board. So all these 5 different constituencies make up the 21-member representative, which really is a representation of the key stakeholders in South Africa as far as TB and HIV is concerned, right? So just to importantly note is that 40% of our CCM representative is made up of civil society members who are part of the communities that we serve. And in many cases who are directly, affected or infected by HIV and TB. So this means that when decisions are made, whether it's on budgets or programs or policy priorities, they are shaped by the very people who carry both lived experiences and deep community insight, right? So in summary, the Global Fund in South Africa does not sit right at the top. It sits alongside its community actors. So it funds and it enables and amplifies the work because only by centering communities we can really hope to end the 3 epidemics by 2030. So in summary, that's how the Global Fund mechanism works in South Africa through the work of the CCM and the oversight that we provide over the investment that we receive from Global Fund. Thank you.
That's a really great opening answer, and I think we had a speaker from Gavi the Vaccine Alliance last month who was also from South Africa, and we heard something a little bit similar, I think, in terms of how it's really important to get civil society scrutiny of these very big investments and very important investments, and people sometimes think that a big multilateral, you think of the large sums of money we're talking about, that they just give the money to health ministries or pay for medical technology and that's it. And it's really wonderful to hear you set out that it couldn't be more different from that. That all the different people who are involved working side by side. So thank you for that. I'm sure we'll have some more to ask about that in a minute, but let's move on to the second question, which is from our online group. I think, Jill, were you able to ask that second question?
Yes. Hi there. What are the biggest health challenges in South Africa at the moment?
Okay, thank you. So South Africa continues to face very complex and intersecting health and social challenges, right? Many of which are deeply rooted in structural inequality, in poverty, and also unemployment. One of the most pressing issues is the youth bulge. We have a large and growing population of young people, and far too many fall in the category of, needs, simply meaning that they are not in education, they are not in employment or in training. So this lack of opportunity increases vulnerabilities to risky sexual behaviors, whether it's transactional sex, substance use, and mental health crises, especially for adolescent girls and young men in low income settings, right? So health services, particularly in the public sector, are overburdened and congested. So many facilities operate with long waiting times, with limited staff and stockouts, leaving communities underserved and demoralized. So this is particularly hard on our young people and our key populations, especially the LGBTQI, people who use or inject drugs, and also sex workers who may already face stigma or fear when seeking care, right? So another major concern is the extremely high HIV prevalence amongst sex workers, with an estimated amount of around 57% rather. This is a public health crisis, not just for sex workers themselves, but also for the clients and broader sexual networks. So many sex workers also operate in contexts where their rights are not protected and access to tailored services is limited. So when we look at TB, the picture is equally very worrying. South Africa remains one of the top 5 high-burden TB countries in the world, with over 280,000 TB cases being reported annually, and a significant proportion of multi-drug resistant TB, right? And also a high co-infection rate of just over 60% of TB patients who are also living with HIV. So many of these cases go undiagnosed or untreated due to barriers in access, especially in informal settlements like your mining communities and your rural areas. So people living in this context often lack transport or live in overcrowded housing and experience frequent health system failures, right? So all of this exists within a wider context of poverty, and unemployment and urban informality. In many informal settlements, there are no clinics nearby. There is limited access to clean water or sanitation, and very few youth-friendly or gender-responsive services. So this leads to risky social behavior, low health-seeking behaviors, and poor retention in care. So the Global Fund is really helping address some of these challenges, through some interventions, including, targeting combination prevention programs for adolescent girls and young women, peer-led services and safe spaces for the very same adolescent girls, sex workers, men who have sex with men, and people who use drugs. We also have mobile clinics and outreach in underserved districts that are hard to reach. We're also scaling up some TB case findings and TB preventative therapy through digital chest x-rays placed under underserved facilities. So investing in community system and civil society organizations. I'm hearing an echo. I'm not sure where it's coming from. Okay. So, as I was saying, so we're really investing in community systems and civil society organizations that fill the gaps where the state cannot reach, and most importantly, enabling community-led monitoring so that communities can hold facilities accountable when services fail, right? But just in conclusion, in 2022, just to give some stats, just over 124,000 sex workers, 98,000 men who have sex with men, and 36,000 people who inject drugs were reached with targeted services, which were made possible by the investment of the Global Fund. So over 178,000 people with TB were also treated successfully through Global Fund support. And we have improved our TB and HIV integration and treatment adherence models, right? And I think I've already touched on the many organizations that have been strengthened through community systems, including training and peer navigators and frontline workers. So while there are many challenges in South Africa, the Global Fund's presence in the country is strategic, and it is responsive, and it's community anchored, helping us move towards a future where access to quality healthcare is not determined by geography, income, or identity. Thanks.
Again, fantastic comprehensive answer. Thank you very much for that. Again, I
Thank
can
you.
see there's already some questions in the chat that are going to be digging into that a little bit more. Obviously, some very sobering problems there. Perhaps not a great surprise to some of the people on this call who know a bit about it. But thank you for sharing that, and also the those big numbers that are being reached by Global Fund interventions, especially with those key populations. So the third pre-arranged question, I think should be coming from London. If there's someone from London who's got the question to hand, if not, I will use my chair's privilege to ask the question. Let me do that. So the question I think you're expecting to be asked is really, what's your vision of the future of health provision in South Africa, particularly with new challenges coming in, like you've mentioned already, drug-resistant infections, but also things like climate change?
Yeah, all right. No, thank you. So, yeah, my vision for health in South Africa really is grounded in the principle that health is a human right and not a commodity. It's a vision where every person, regardless of income or gender or race or identity or location, can really access quality, respectful, and affordable healthcare when and where they need it. But to realize that we really need to reimagine our systems and address the deep structural and social drivers of poor health, right? We can talk about universal health coverage that leaves no one behind. We must build a system that moves beyond fragmented and facility-based care, a system that prioritizes prevention, primary health, and integrated service delivery, especially in poor and rural communities. This includes rolling out mobile services, task shifting, and youth-friendly models that are really designed with communities, not just for communities. For instance, the introduction of the game changers, such as the lenacapavir, which is the long-injecting HIV prevention jab, which I'm very happy to say that the Global Fund has really been generous in that they've allocated us, some jabs as we move towards implementing GC7, which starts on 1 October. They really, prioritized this for South Africa, considering the incidence rates that we have, especially around, our adolescent girls and young women. So my vision then is that this should be accessible to all, especially those that are, at high risk. We also need to protect our frontline workers and the informal economy. As someone rooted in the labor movement, I really believe that workers are central to the health system, from nurses and our community health workers to peer navigators to cleaners. We need better working conditions, better protection, and fair wages for those workers, especially those in the community sector, many of whom are underpaid or treated as volunteers. But at the same time, we must also ensure that informal workforce, which makes up a large portion of South Africa's economy, has access to occupational health, to social protection, and tailored services, including TB and HIV. I also believe that we need to have youth and community leadership. Our future health system must make space for young people and communities to lead, right? Not just be passive recipients of services. So we need to invest in their capacity, in their ideas, and their organizations. And we must protect girls and young women, not only from HIV, but from poverty, from gender-based violence, and lack of opportunities that drive new infections and poor health conditions. I think as I was listening in, you touched in on pandemic preparedness. I think for us as a country, South Africa, COVID-19 pandemic really exposed just how vulnerable our systems are. So drug-resistant TB is already a reality here, and the AMR will only grow if we don't strengthen surveillance, or we don't strengthen diagnostics or our supply chains and responsible prescribing, right? So the Global Fund is already helping in this regard by investing in lab systems, in data architecture, and resilient supply chains. And it must continue to play a role in South Africa's pandemic preparedness and response strategy going forward. You've touched on the issue of climate change. So we need to build climate resilient health systems. You know, climate change is no longer a distant threat. It is here. From heat waves to floods and water shortages to disease outbreaks and displacement. You know, climate change is a health issue. Our future systems must be climate responsive, building greener infrastructure, emergency response systems, and protecting communities most affected, including farm workers and those in informal settlements, right? And lastly, maybe I should just touch on the issue of sustainable funding and global solidarity, is that none of this is possible without sustainable, equitable financing mechanisms. The Global Fund remains a critical partner, not only as a donor, but as a platform for governance, accountability, and also inclusion. So we will continue to push for the reforms that ensure communities lead and that every dollar raised through the 8th replenishment delivers maximum impact where it's needed the most. Thank you so much.
Thank you. Again, lots to unpack there. I think you've spoken really eloquently about the link between poverty and ill health and lack of access to health, and again about the importance of equity. And I guess that shouldn't be a surprise to us, seeing you're from a labour rights background. So we're really all of those things you've said speak very much to some of the things that we have been advocating for a long time. I'm going to open the floor now to anybody who wants to ask a question. We've got a few in the chat, and I see that we've got a hand up as well. So, you know, it's really important for us, and thank you so much for your answers so far, to understand the work of institutions that we advocate for, such as the Global Fund. So whilst many of us on this call think we know the Global Fund very well, it's always really important to hear it firsthand from how it works in a country, and how it helps to meet the needs of those different communities that you've mentioned, making sure that the health services are appropriate. And that's very similar to, again, as I said, what we heard from the Vaccine Alliance and the way it works last month. So look, I'm sure there are going to be more questions now. So please unmute yourself, ask your question if you want to, or put it in the chat. Do introduce yourself before you ask your question. As always, I have got my phone beside me, and if you want to text me instead, then please text your question to 07906 662 571. That's 07906 662 571. But I am going to start off with Kathy, who's got her hand up.
Thank you very much indeed. I appreciate that. And it's very interesting to hear from you, Mulalo. Thank you very much for joining us. I have been very interested in the relationship between the labour movements and the Global Fund, because actually, I think that that's a gap we have in our country, that the level of civil society that actually we're missing is the civil society element. But I actually particularly just wanted to ask, what's been the impact of the PEPFAR fiasco that has come down from the United States, when it's been there, disappeared from, maybe coming back? Has the Global Fund picked up any of the slack, and is it willing to, in the light of the situation, the ongoing situation with aid in the UK? I know Karen's asked online on the chat a similar question, but specifically about the PEPFAR, if I can.
So can you just remind us what PEPFAR stands
It's the president's specifically HIV program, which kept very separate clinics from the Global Fund and did not actually allow it. It was running parallel, and then it was completely cut. The number of people that were going to die was sort of a little bit of a shock, and so they retracted a bit, and then it's in limbo now, but people are turning up at clinics with the doors shut, nobody's there. So I just wondered what the Global Fund's response to that has been.
Yeah, no, thank you so much, Kathy, for that question. Look, I think as South Africa, we were not spared, right? We really have felt the negative impact of the withdrawal by PEPFAR in South Africa, because PEPFAR had really been with South Africa for many years. And it has really been supporting many of our interventions that have been implemented through many of our civil society organizations, right? So as a result, then at this point, the Global Fund seems to be the only, donor funding that still remains in South Africa that's really trying to bridge the gap, especially in light of the different districts where PEPFAR was implementing and it had to withdraw. So it left many of those districts very vulnerable, without key interventions. However, we were very happy that with our engagements with the Global Fund, they did recognize that PEPFAR has pulled out of what we call high burden districts, where we felt as the Global Fund, we need to look into those districts, move into those districts that were previously being covered by PEPFAR, because I think that's where we're going to make an impact the most. So we have gone through that exercise with the Global Fund, and we have identified districts that were covered by PEPFAR, and I'm happy to say we have taken most of them. We have taken over most of them based on the data and what the reports were telling us in terms of the high burden and the impact that the Global Fund investment will make in those. So yes, happy to say we have taken over some of the districts that have been left vulnerable as a result of the PEPFAR withdrawal. Yeah.
Thank you. And can I follow up then with Kathy's, Karen's question in the chat? So I'll read that out in case you can't see the chat. Have cuts in aid, I guess, including from countries like the UK, but particularly USAID, affected TB drug supplies? So are you seeing those kind of approach of the donors withdrawing affecting the Global Fund's provision of TB treatments yet, or not?
No, not really. We have not seen that. But also just to say, I think the procurement of drugs in South Africa is funded through the South African budget, through the Ministry of Health, right? So the withdrawal of PEPFAR or USAID has not really impacted, drug supply in South Africa. But the amount, there is a portion of funding that we receive from Global Fund that's specifically ring-fenced to procuring buffer stock. So we do have that provision in the Global Fund budget to procure buffer stock, whether it's TB or HIV treatment. But no, simply no, we have not really seen a negative impact in terms of drug supplies. Yeah.
Thank you. There's a couple of questions in the chat from Pete, which I will read to you. Firstly, you mentioned in one of your answers about the co-infection of TB and HIV, and do you see that figure improving? And secondly, this is something that we've worked on as results in the past, a long time ago now, but is there still a high amount of TB being exported and spread through the mines? The mine workers then go back to their communities. Is that something that's still a problem today?
Yeah, no, thank you so much for that. So in terms of the co-infection of TB and HIV, unfortunately, yes, we do still see those cases coming up. Majority of our people who are living with HIV do have an exposure or be co-infected with TB as well. So we still do have those cases quite significantly high in South Africa. In terms of the high amount of TB burdens from the mines, yes, interesting, because I come from organized labor, right? So we've got a mining affiliate under COSATU that organizes strictly in mining. So we have seen there has been a decline in some of the mines, but I think gold mining is still a problem in terms of TB incidence rate, specifically because of the silica dust that's produced in gold mining. So we have seen quite a spike in terms of TB infection rates in the gold mining sector. But other mines, we have seen some great improvements. But yeah, gold mine remains a challenge. Yeah.
Thank you. I see a question in the chat from Jill, which is related around. I don't know if you will know about this because we were working on this some 10 years ago, I think. There was a film about gold miners, and miners rather. I don't know if it was gold miners. And I think it was called They Go to Die. Is that right, Jill? So some of the mines were owned by UK companies, and there was advocacy to make those UK companies change their practices. Are you aware of this? And is there something being done, and are things improving, or is that not something you know about?
No, it's not something I really know about. I will be interested also to just watch the documentary. It sounds interesting, but what I can do comment is that living arrangements in the mines is still a problem. They are still living in what we call a hostel setup, where you've got a lot of our mine workers, sharing the same sort of hostel like setup. So we do then experience those issues of, co-infection amongst the mine workers who would be sharing that particular hostel at the time. I'm not so sure about, the kinds of pressures that has been put that the UK has been or owns the majority of the mines in South Africa. I don't really have much knowledge about that, but I do know that at least from an organized labor point of view, organizing in the mining sector, we've really been trying to engage the employer to see how we can better the conditions of mine workers, especially in trying to curb, infectious diseases like TB in the mines. Yeah.
Great, thank you. And I think that's important to see that from your perspective as the sector as a whole, rather than individual companies. Go ahead, Jill.
Yeah, just wanted to follow that up because it's reminded me what was happening was that miners were coming from all over the Southern African countries to work in the South African mines, and then once they got TB, they were sent home to die. And whereas some of the mines had treatment centres, they received treatment. Once they went back to rural areas, there was no treatment, and then they infected 15 other people, and that was another one of the asks, was that there should be treatment centres, and also that there should be joined up thinking on the treatment, because the miner who went to another country had to start again with his treatment, and they were falling through the net. That's something about labour rights, and I thought you might know something about that.
Yes, I do know something about it. We have got a project called Compensation for TB in the Mines, I think, which speaks directly to what you're referring to, is that a lot of mine workers that we had in South Africa, countries, Lesotho, Botswana, Mozambique, Namibia, and when they got sick with TBs, you're quite correct, they would be sent back home to go and die. And what is interesting about that entire arrangement is that currently, as we sit in South Africa, we're sitting with over 2 billion rands of funding that is meant to compensate those very same workers who acquired or suffered TB in the mines, even dating back to the late 80s, early 90s, right? And the challenge with that is that as we sit now as organized labor, we're actually struggling to trace some of those mine workers because, like you said, when they got TB, they were sent back home to die. So some of them, majority of them, are no longer even in South Africa. They've gone back to their own home countries in Lesotho, Mozambique, Botswana, and we are struggling to really track them. And the reason why we want to track them is that we know that they have suffered TB or other lung diseases in the mine, and we'd want to compensate them. But having learned lessons in that, I think a lot of mines have really moved towards having, healthcare systems built within the mining environment to try and address things like TB and other lung diseases in the mines. And I think a lot of mines are really doing great work in terms of screening issues of TB and HIV directly in the mine setup. Yeah.
Thank you.
That's really pleasing to hear that you think there's been progress there amongst the behaviour of the mining companies. Deirdre, I see you put a comment in the chat about that. Did you want to come in on that point?
No, I'm just remembering all the things which Jill has summarized from the film, and how at that point there was very little responsibility being taken by the mining authorities for the health and the living conditions of their workers. So it's really good to hear that things might have improved.
Absolutely. I see we're coming up to the hour. So there was one other question which I saw on the chat, which I think is a really nice one to end on, again from Jill. Mulalo, what would you say is the positive progress that have been made with health in South Africa that excites you the most? Interpret the question how you will.
Yeah, so I think for me, like I mentioned in some of the responses earlier, is that the investment that we really receive from the Global Fund has really made a significant improvement, in our health system, especially because some of these interventions are, implemented at community level using, grassroots organizations that are also based in community levels. So we are trying, to break the barriers to accessing equitable healthcare service when and where we need it most. And I think I've also mentioned the burden that we have on our public healthcare, system and facilities in South Africa. So when we have this kinds of health interventions that are implemented directly at the communities, by grassroots and community-led organizations, it has really improved, our health systems and our health outcome. And this has really been made possible by the investments that we receive from Global Fund, from procurement of mobile units that go door to door and screening and testing and finding missing TB cases, finding our people who are lost to treatment, linking them back to HIV treatment, and just bringing them back into care. So all of this has really been made possible by the investments of the Global Fund, that we are able to implement healthcare interventions directly in the communities where they would ordinarily experience challenges or barriers in our public healthcare facilities. So just a highlight. Thank you.
Thank you. That's a great place to end. That real endorsement of the importance of reaching out to communities and really being there where people need it and doing what they need rather than a top-down approach. So that's got to be the end of our questions. We've run out of time, and it is very late in South Africa.
Yes.
So Mulalo, thank you so much for being with us and for sharing your expert knowledge. It's a real privilege to hear from you. And all of us on the call this evening are really keen to support this work, and many of us will be asking our government here in the UK to support the 8th replenishment very soon. So thank you for being with us again, and thank you for inspiring us to action.
Thank you.
Thank
very
you
much.
so much. Thank you,
I'm gonna
everyone.
finish the
Thanks for
call
the
now.